how inferences are made. For example, activity participation, how actively and willingly, creatively, proactively, productively the stakeholders and the clients are participating in the work, sports, social events, hands on activities, and volunteering activities, how the clients are picking up all this engagement and communication and involvement again. Step number five, identify who is responsible for data collection and timelines. Now, these are very strict rules. You can approach this answer in your own terms and terminology, from your own point of view and perspective, with reference to context of your workplace, with reference to context of CD, the way you are approaching it. But my response is, ignorance of the law is no excuse. So make it your responsibility to read, stay abreast of any developments and updates on your roles and responsibilities, timelines, schedules, and how and what you have to do, and who is responsible for planning and devising the systems. It is mandatory to respond via email to all confirmations of whether you're on the same page as the team of the CQI plan. Maybe every 3 months, data is collected, tabulated, and converted for trends to guide further improvement, and it should be presented and discussed so that things can be reviewed. And maybe after every 6 months, micro and macro goals of client rehab and wellness and assimilation into family, community, and society is measured. So every 3 months, data should be collected, processed, and studied, and every 6 months, on a micro level and at a macro level, you should see how well your clients are being rehabilitated and how well they are feeling, how much better than before they are feeling, and whether they are being assimilated into family, community, and society in a smooth and hiccup-free and a very pleasant and smooth manner. The transition back to normal and healthy life should be very smooth for them, because we're talking about DNA rehab. Every 3 months, funding costs, materials, resources, funders, support services, council grants, needy client social support should be reviewed and revised. Now we come to point number 6, step number 6. Now read carefully. Step number 6 is asking, identify who will evaluate the data, how it will be reported, and when. My response is, after a whole year of minutely detailed efforts to improve our quality of care, treatment, and rehabilitation services to our DNA affectees, we presented and reviewed our CQI plan results. We met with all the internal and external stakeholders at our council's conference hall, where management and team presented various results in different forms. Reports were read, run charts, flow charts, pie charts, bar charts, graphs, audio and visual data, voice messages of the clients, consent acquired, were all presented and reviewed. And maybe you would like to, just draw in a small scale drawings of a couple of ways you are going to present data. For example, maybe you could draw a small bar chart or a graph or a Pareto chart or a flow chart, or a miniature of a report. Just draw it here, just to show that this is how you're going to present the data. At the end of the video, I might include a photograph of how I've done it, but please vary it according to your own approach. Number 6, continued, is asking recommendations based upon the evaluation. State the actions you see as necessary to improve the effectiveness of the CQI plan. Over here, you have to write more effective and relevant measures can be implemented if regular cross-suburban services collaborate to discuss best care and treatment plans. Another point could be obstacles, disappointments, any issues, difficulties with clients need to be addressed in a prompt manner. rather than sitting on them for 3 to 6 months, because freshly tackled they will be dealt with more effectively. After all, justice delayed is justice denied. So as and when issues and problems arise, they should be dealt with there and then. Because when you delay resolving issues and challenges and difficulties or disappointments or any failure of compliance, if you delay resolving the issue, it is going to magnify in magnitude. Number 3, you can write more online meetings or in between meetings should be held. You know, small meetings, even between 2 big meetings, you should stay connected and communicate to each other what's happening. Are you all on the same page? Or are there any new things that have been observed by a couple of team members that they should communicate to the others? After every 4 weeks, everyone will comment online, or there will be a video conference on any one of the video conferencing apps, you know, like Zoom or any particular app for your service, and briefly share improvements acquired, results achieved, and any issues being faced for on-the-spot resolution. The next part is quality improvement tools. Maybe you would like to mention these 4: charts, benchmarking tables, root cause analysis, brainstorming. And now we come to page 45, CQI team members. Champion. Now over here you will write the names of your colleagues, of your team members who you've selected to be the champions of the CQI team. CQI, Continuous Quality Improvement Team. So name them. And also after naming them, for example, you've got 5 or 6 and you name them, and then you have to write exactly what they're supposed to do. Who will they inform? Who will navigate and collect data? Who will analyze and process it and draw it up and present it at the meetings? Say that this person is assigned this person is going to do this, so on and so forth. Program administrators, again write the names of team members and say these are the people who will manage and ensure that quality improvement will be a smooth transition and adapted gradually, step by step in different stages. Community stakeholders, again, who are the people who are your stakeholders? Are you hiring and engaging the services of people from other healthcare clinics, or are you bringing in some counselors or wellness coaches? Are you bringing other companies using products and services from other people? Mention who your community stakeholders will be. For example, I've written so and so of the DNA counseling, Mr. so and so of this health and wellness service, and Mr. so and so from the community HR department, and these people from the local community centers are organizing regular recreational and wellness sessions for our clients, etc. Okay, next, data specialist program evaluators. Again, you are going to name the team members and say what they are going to do. What is this team in charge of? They are in charge of mincing and processing raw, unedited, meaningless volumes of data, and they are going to process tabulated and inferred data, meaningful data, so that we have well-presented quantitative data on which to further base our work. Management. Who is management in your organization? What are they doing? How are the managers helping those below them who are helping those below them? How is the whole management admin team of your organization working? And how are the tasks distributed across the board and down the hierarchy? Okay? It should be 5 to 6 lines. And now we come to Appendix 2. Appendix 2 is an email template. You have to, please, as I've told you in our classes also, please always read the instructions prior to each question, because I have to save time on the video. I am not reading all these important instructions, but I've told you face to face you have to read the instructions very minutely to be able to answer correctly and relevantly. So always read the preceding instructions, and now in this email you have to send it to all the team members and alert them, invite them, inform them that a meeting is coming up and what the agenda will be, and you know what the meeting is all about and who will be doing what and what are your aims and objectives to be drawn from this meeting. So for example, from of course your email address, it could be, you can assume an email address. Okay, so and so 197 at gmail.com. To who are you addressing it to? Who are you CCing? BCC not applicable. Attachment plan. Subject CQI meeting. Now this is just an idea. This is just to give you an idea. You have to vary it according to your setup. Hello all. Please refer to the attached proposed plan in preparation for our meeting scheduled to take place. Time 9 a.m. to 4 p.m. Duration 6.5 hours with a 1 hour lunch break. Topics to be discussed, brainstormed, and quality improvement areas to be determined. Goals, aims, and objectives of our services CQI plan, familiarizing ourselves with all the roles and responsibilities and task allocations. Timelines and durations, submission dates and due dates will be discussed. Tasks will be outlined and described in great detail to ensure everyone is clear on what they have to do. Teamwork and cooperation, everyone is told to show patience, cooperation, and work together with each other. Motivation and inspiration for patience and perseverance. Looking forward to a most productive, interactive, and result-yielding meeting where we can draw up our QIP effectively and relevantly. Cheers, regards, and then you can sign your name. Okay, so this is your email being sent to everyone to tell them that at this meeting everybody is going to find out what they are going to have to do, and these are the aims and objectives, timelines and due dates will be given out, everything. So this is your appendix 2. Now carefully read the instructions on page number 47, and then we come to appendix 3, which is very self-explanatory. It is continuous improvement plan, the cover sheet. So on the cover sheet, you will write the name of the organization, which is CD. Organization head office address, it's a simulated site. Service details, write external services invited. You can give a phone number, a landline phone number. Departments within CD, give another phone number. Any other consultations involved, any other services, any other organizations involved, give a phone number, or give their address, their outlet address. Contact details for organization. For example, I'm just making up a name. This is all assumed. Just write, maybe you can write Rick Davis Consultancy. And then their email address, just write an email address below that. Signature of above named person comes here. Due date for submission, write a due date here. Then due date for the review of the continuous improvement plan. Very important to note, and the review should be after maybe 6 months. And then you have to write the name of lead region contact or contract manager. So you can write the name of a DHS representative and their email address. Okay. Now this is the template. That was the cover sheet, and this is the main template. So I'm now on page 49. All right, I am now on page 49. Be very careful. You have to read what you have to put in the table here. So after reading the instructions, you'll find that the rating of the first column is standard indicator. The second column says rating from self-assessment and or date identified. You can say partially met, or whenever it is not met, your expectations, you can tick that. Barrier or issue and improvement action required. For example, in the first column, first row, third column. I have written, we would like to have a more prompt reporting of any glitches or hitches in the form of Zoom or face-to-face meetings. Person responsible to action, for instance, Kelly. Date required by date. You can write a required by date. For example, 15th of June. Outcome and date closed will of course come afterwards. Depends how long afterwards you want to write. For example, if you've written 15th of June, then maybe you can write 31st of July. And you can say planning is underway. Just write below outcome and date closed, planning underway. Review date, you can say review coming up on 30th of November to ensure that expectations are being met. In the next column, again, you can write barrier or issue, an improvement action required, more effective work practices to be introduced by collaboration from counterpart organizations from within our suburb. Who is responsible? Maybe Jason. Required by date, 15th of July. Outcome and date closed, 31st of August. Relevant access allocated. And the review date, 28th of February, the following year. So on and so forth. And now we come to